अगर किसी को prostate cancer detect होता है and if their given doctor already just advises कि आपको surgery करानी चाहिए, तो what do you think, should everybody go for a second opinion or a third opinion always, या फिर if you trust the doctor just go for the surgery directly?
Yeah, very, very good. I think the first opinion is of the doctor. The second opinion is of Google as well, isn't it?
Yes.
And the third, because there are lots of sites where you can have risk stratification done. So if I get almost one call a month from India about discussing prostate cancer or bladder cancer options, treatment options, and all those things. And I ask for various other factors. And the important thing in prostate cancer would be, I would say, what is your PSA? What is your Gleason score? What is the extent of the spread? And then I will decide based on that. So there's no harm in getting second opinion. Here in our system, what happens is that most patients come fully informed. We give them choices. After the diagnosis, the first person to give the news to the patient is usually a clinical nurse specialist. And he or she gives the diagnosis, the diagram, and with all the relevant features and the important message about what sites to go. UK prostate cancer site is a very good one, and that you can go there, look at it. These are your findings, your PSA, your Gleason score, and all those things. And then you can just carry on with that. And they will give you the options, and they will give you the risk stratification to say, if you have surgery, this is your chances of benefit. And with radiotherapy, this is your chances of benefit, or this is the chance of recurrence, that way. So it is very important. That.
Also, so a lot of times biopsy is recommended by the doctors and the patients are a bit hesitant कि हम biopsy के लिए जाएं कि नहीं जाएं. तो क्या हमें हमेशा biopsy करवानी चाहिए या फिर नहीं?
Lovely question. Lovely question. And this is important. I would only in one situation say biopsy may not be necessary when the PSA is, say, more than 100, when I know for sure that it has spread into the bones and therefore hormone treatment is of importance. But 9 out of 10 times, I would never treat a prostate cancer without a biopsy result. Okay. It is very important because that's how you're going to identify. Now, look at the other side of the coin. You have a raised PSA, somebody's PSA, a normal PSA is up to 4, maybe an age specific is slightly different. But if you take a ballpark figure of 4 nanograms per mil as a PSA cutoff value, then at that level, after that, if you take a biopsy and the biopsy is negative, does it mean he's got no prostate cancer? No, it doesn't. It just means that you have not found it. That's what I believe. And therefore, we may have to, sometimes we find prostate biopsies after 2nd, 3rd, 4th biopsies even. But MRI has certainly improved the situation. That is for sure.
Thanks.
Okay. So I just want to touch what is new, because otherwise prostate cancer, again, you can talk for days on it. But certainly we have a better understanding of the role of PSA, as I alluded to. Screening is for selected population only, which means patients with familial prostate cancer or those who've got a family history of prostate cancer. Better diagnosis with trust-guided machine. Previously, we used to do digitally guided, which means just on the finger, you pass a needle and you take a biopsy and you get it. So it is a hit and miss, high chances of failure. But here we have got an MRI result, we've got a transrectal ultrasound scan or transperineal ultrasound scan, and take some very targeted biopsies as well. Use of MRI and PET scan for diagnosis and staging, that is important. 3D conformal radiotherapy reduces the side effects, and now robotic radical prostatectomy is the ultimate choice now. And you see a picture here, the surgeon is sitting here in the console, the patient is lying on this side and with the laparoscopic ports put in, and the surgeon is just manipulating the structures in the body to take the prostate out. So what does it do? It gives you a 3D vision of the prostatic. It is one of the most difficult operations to do in urology. There's a long rising curve as well, long learning curve, but to learn it is very, very difficult. But with robotic, the vision is so good that it is making life much easier. The blood loss has been minimalized. The anastomosis between the urethra, the water pipe, and the bladder is good, and we can save the nerves going to the penis so that the erections can be preserved in some patients. That is robotic. That is the ultimate.